And background noise.
All right, everyone. What I'm going to do is demonstrate on Katie EOE, okay, intraoral extraoral cancer screening. All right. First thing we always want to do is actually capture consent from the patient, especially since we're going to be palpating areas that may be somewhat sensitive to a patient. And so always ask, Katie, I'm going to be doing the extraoral cancer screening, intraoral cancer screening. Do I get permission to palpate the head neck region?
Yes.
Okay. All right. So what I normally do is I always start from behind. Okay. And what I'm going to do is I'm going to be having her look straight ahead, put her head down, and then at her hairline, I'm going to take two fingers, start at the midline, at her hairline, and I'm going to do small circular motions. No dancing fingers. Okay. Don't do jazz hands. Okay.
Oh.
All right. We actually are going to small circular motions following the occipital region, okay? And I'm going to go to the post-auricular right after that, okay? So right behind the ears, all right? See how my fingers are kind of doing a small circular motion? I'm not doing this, okay? That's what I see a lot of people do, and I don't want to see that, okay? That's not palpation, all right? This is palpation, all right? Then I'm going to have her put her head back for me. I'm going to slide in front of her ear, okay? And I'm going to do the pre-auricular, okay? Then I'm going to do the pre-auricular. I'm going to have her relax, okay? And then I'm going to kind of slide forward a little bit. And as she's relaxed, I can check the carotid, okay? Carotid gland. Then I'm going to have her clench together. As she clenches together, there's a muscle there that becomes tense that I can feel pretty well. What do we call that muscle? The masseter muscle, okay? So I'm going to palpate that as well, okay? And then I'm going to have her relax. I'm going to slide forward, or upward, should I say? And I'm going to have her clench again for me. And what muscle is this?
Temporalis.
The temporalis. Excellent, okay? And we're going to palpate that as well, all right? So now what I'm going to do is have her put her head forward for me a little bit, okay? And now I'm going to start palpating other lymph nodes, okay? First of all, I'm going to do the submandibular region. And what I'm going to do is I'm going to take the tissues from the opposite side and kind of push them overward. And then I'm going to go from the angle of her mandible, right by her ear, and I'm going to try to roll, taking two fingers and trying to roll any lymph nodes over the angle of the mandible. Okay? Just like this. All right?
Looks like it feels good.
All right? And we come right to the actual midline. Now, as I get to this portion right here, this goes from the submandibular region to the submental. Excellent. Okay? So I'm going to do the same thing. And I'm going to come over to this side, do the exact same thing. And I'm going to try to roll any palpable lymph nodes over the angle of the mandible, or over the chin as well. Okay? So I don't feel anything. All right? Now what I'm going to do is I'm going to actually have her open and close. What am I checking right now?
That's in
That's the tempomandibular joint, okay? So I'm going to have her open and close. And close. Now I can feel bilateral clicking and popping. So what do I call that? Crepitus. Excellent, okay? Also, when she opens and closes, one side opens before the other. And it also closes before the other. Go do it real slow for us, Katie. One side opens and closes before the other. And go close.
Her right?
Her right. Okay? And so she has a deviation to the right. Okay? And we call that somewhat subluxation because the jaw kind of doesn't hinge in a normal pattern off the temporomandibular joint. Okay?
It
And so
doesn't hinge at the same time.
Exactly.
It hinges at separate times.
separate times. Okay? And so we're going to actually identify that and we're going to annotate it. Okay? Now, say when she opened up and she kind of got locked in place, what would we call that?
Lockjaw.
But what's the word for it?
Something I don't know.
Okay.
Is it starting with a T?
Starts with a T. You're close. Trismus.
Okay.
Trismus. Trismus.
Like Christmas with a T? That's
Yes,
exactly
okay.
what I said.
And so it's Trismus. Okay? Trismus. Okay? And so if she was locked into place, that's what we would call it. It's called Trismus. All right? So now that we actually did the TMJ, I'm going to come from the actual front now and look at it as well because I felt it from behind, but I also want to see it from the front. All right? So now I'm going to have her open and close for me. And close. Okay? So I can see the deviation. I can also feel it. Okay? Now also when I'm doing that, I'm going to be looking for symmetry. I want one side to look like the other. No lumps, no bumps. If there's anything on the head neck region that is looks abnormal. There's a scar, like she pointed out, a scar above her right eyebrow. We want to know why that scar is there. Okay, we want to measure it with our probe. Don't touch the skin; just put it close to its proximity. All right, but we want to measure it and ask the history of it. Okay, I told the previous group that was here that I said my sister gave four of my brothers and I a scar somewhere as we were growing up. Okay, so it could be something as innocent as that, but it could be something that actually she had a history of
Biopsy.
a biopsy, exactly. And there's a history of skin cancer or neck cancer. We want to understand why, okay? And we always want to intake those things, all right? So now what I'm going to have her do is I'm going to have her turn her head this way for me and push her chin down to the palm of my hand, all right? This is going to stretch out the SCM, all right? What I'm going to do is start right behind the ear, on the medial portion of the actual SCM, and I'm going to do small circular motions, okay? Small circular motions. All right, and then I'm going to do this right to the triangle. And I'm going to slide backwards, and I'm going to go to the distal portion of it. All right? So I go to the back of the ear. Then I'm going to roll over it to see if I can palpate any lymph nodes. Okay? Then I'm going to go from the actual triangle to the shoulder, and we call that the supraclavicular. Okay? So we're going to do that all the way to the shoulder. All right? I'm going to do also on this side. Push it down. Once again. Okay. Okay. I'm going to look straight ahead. Now I'm going to check the thyroid area. I'm going to actually kind of palpate the thyroid area. 2 fingers. I can do it from. I like to do it from both sides, to be honest with you, because I don't like palpating with my thumb. All right. And I'm going to have her actually swallow for me. See if there's any difficulty swallowing. Okay. Now I'm going to check her range of motion. Okay. So I'm going to ask her to take 3 fingers, and I'm going to ask her to see if she can insert her fingers vertically into her mouth. All right. So go ahead and try that for me. Just like that. Okay. Just to make sure we have good range of motion. If her fingers start to overlap, or she can't open wide enough to put all fingers in, then she's going to have a limited range of motion. You will identify that and indicate the right thing, okay? One thing I overlooked when I was palpating lymph nodes was also the glands, all right? I rolled over the actual lymph nodes, but I also want to check for the glands. So with her head relaxed, I'm going to come up underneath the inside portion of the mandible, and I'm going to push up, and I'm going to palpate like that, okay? And
Should
I'm
we
gonna,
do it up in the floor of the mouth too?
when I go internally, I will do that as well.
Oh, okay.
But this is just extra early. So, and same thing on this side. I'm gonna push up. Okay. I'm gonna do an under the chin as well. Okay. I'm actually pushing the tissues up into the glandular area so that I can actually palpate the glands themselves. Okay. Any questions regarding that? One thing I didn't mention is I also want you to be looking at the vermilion border, the tubercle, the actual filtrum, the commissures, the canthus, inner outer canthus of the eye, okay? All those things I want you to take a look at, all right, when you're identifying the symmetry, okay, or any type of lesions, okay? Yes, ma'am.
When you're doing the range of motion, is there a reason why the patient uses their fingers
It's usually
instead of you using yours to do a
it's
range?
usually anatomical to their proportional to their body. That's why we do that.
So, okay.
Okay. So now that I'm done with the extra oral, what do I do with my gloves?
Blossom.
That's exactly. I'm gonna switch them out. Okay.
That looks so relaxing. Massage going.
What are you feeling from? Or what does it feel like?
It feel looking for little lumps and bumps that kind of that we can call palpated, that roll over structures. Okay. The lymph nodes are little bean-like structures. Okay. And when you have some type of infection in the head neck region, sometimes that's usually the pathway in which it drains, or the infection spreads. And so we have to be cognizant of that. And if they're firm and don't really move very well, we're concerned about that. If they're palpable, they kind of do move a little bit, it's okay, okay? As long as we observe them. Usually we have what we call a 2-week rule. The 2-week rule is if something's there and hasn't resolved itself in 2 weeks, we want to send it out for referral, okay? Because the most common thing is, people don't refer out in a timely manner. Okay, and early detection is key for long-term prognosis, a better long-term prognosis for oral cancer stress. So now that I am, we're going to actually put the bib on you now, Katie. The recording. Slide her backwards. All right. So anytime we see something, we have to annotate it. All right.
Like the red on the neck.
Red on the neck is probably from us touching her from the last
Did you
couple.
note that?
I mean, I just heard it scratching.
So, but if it's something like that, yes, you would note it. Okay. But usually, what do we call freckles? What's another word for them?
Skin pigment.
It's an M.
Macule?
Macule, okay? And so normally if they're normal, if they have a nice circumference to them, they're not elevated, we're okay with it, okay? Especially if it's normal.
So would you still note it?
It depends. If you had one with an irregular border,
What
okay?
about my freckles? Like, what would you say?
If you generalized freckles, no. You
So
can,
you would have to note that?
well, I would say
The
generalized,
EOE.
generalized freckling,
You would put
okay?
the-
But I wouldn't measure every single one of them, no.
Okay. That's what I
You'd be there all day.
Yeah.
So we're not gonna do that,
But
okay?
if they had like one mole that was elevated, you would
Yes,
measure it.
you would measure it,
Okay.
exactly, okay? So, okay. So, what we're going to do is, you're gonna take a moist wet gauze and you're gonna actually have her stick your tongue on it, okay? The reason why we want to be able to take the tongue and actually be able to visualize it. Can you turn on my light for me real quick?
Do what?
The little knob. Yep, just turn that knob so it turns on. Keep on turning it on. There you go. All the way. Yep. All right, perfect. All right, so what I'm gonna have her do is stick her tongue up on me. I'm gonna grab the tip of her tongue with a piece of gauze, okay? I'm gonna pull the one side of I'm gonna feel for the side of it, and then I'm gonna palpate it, okay? I know this tickles a little bit, okay? Same thing, okay? Now she actually has a slightly coated tongue. You'd annotate that. You would also see that she has a little bit of a midline fissure, okay? You would annotate that. And then we're also gonna palpate the actual tongue itself. Go ahead and relax your tongue a little bit for me. There you go. I'm going to palpate her tongue, all right? So I'm going to have her relax. I'm going to have her close down for me. Now I'm going to actually palpate the actual labial and buccal mucosas, okay? Open for me, all right? And she actually has a little bit of scarring in the commissures. That's from biting the corner of her mouth, okay? We've already identified that from the previous time we did it, all right? Now, we also want to look at what we call the vermilion border. There's two vermilion borders. We have an inner and outer vermilion border. The outer vermilion border is actually where the lips meet the rest of the face. The inner vermilion border is where you can actually see where it goes from kind of like a dull color, or a little bit brighter red, to a paler, shinier color, okay? That's the inner vermilion border, all right? So we want to make sure that we identify those and always make sure that they're intact. As you see people get older, okay, that fading starts to occur, okay, and that can be a precursor for skin cancer, okay? Most common type of oral cancer, what is it? Do we know?
Of oral?
Oral.
It's usually located on the sides or under the tongue.
Usually on the side of the tongue or the floor of the mouth, yes. But what type of it is it? Do we know? It's a squamous cell carcinoma, okay? Is the most common intraoral, okay? Extraoral is going to be basal cell carcinoma, okay? So know the difference between those, okay? And so we're going to palpate the lips again, like I said. We're going to feel. And I try to keep one finger that's always in the mouth, and I try to manipulate my body around her so that I can actually not put saliva all over her. All right. And so now I'm going to have her stick her tongue out for me. And I'm going to look all the way back there into the tonsillar region. Go ah. Excellent. Do it a little bit longer for me. Excellent. So what I'm looking for is the fauces area or the tonsillar pillars. Remember, you have the anterior and the posterior. Of course, the tonsil is going to fill in that space. Okay. She does actually have some plaques on those right now. if you've been cold or if you had a cold recently. All right, so basically you want to identify those and just to make sure that we watch for future reference. Okay.
What if somebody has tonsil stones? Do we leave that alone and just note it, or
You're just gonna note it. I mean, there's really not a lot we can do for that. Okay, as from our role, but we will identify it. Okay, and so now we're gonna look actually in the buccal mucosa, make sure there's nothing there. We'll look at the labial mucosa. All right, I'm gonna have to stick the tongue to the roof of her mouth. Okay, you can look at the sublingual frenum, look at the caruncles, look at the various viscosities, and then we're gonna make sure that everything's intact. There's nothing, no lesions in that area as well. Okay. Now this goes back to what we talked about, the palpating intraoral and extraoral. Okay, this is where we do this. Okay, where I'm gonna take one finger on the inside and one on the outside, and I'm gonna try to bring my fingers together. Okay, to palpate. All right, and I'm gonna come from the opposite side and do the exact same thing. Not a lot of room in here. I apologize. All right, but that's what I'm going to do. Okay, I'm also going to palpate the palate of her the roof of her mouth. We want to normally have the nice concavity, any type of elevation off of the actual palate, we're going to call a torus. Okay, remember torus is singular, tori is plural. Okay, so always call it a torus. Okay, she does have a slightly elevated torus. Okay, on the palate, so we call that palatine torus. Okay, and then we're going to check for occlusion. As we check for occlusion, we can see that she actually has a little bit of an overjet. Okay, I don't actually have a actual periodontal probe, but if I did, I would take my periodontal probe and I would put it where it's perpendicular to the lower teeth, and I would measure how far that overjet is. Okay, so that's the first thing I would do. Then I would actually want to check for her occlusion based off of her molar relationship. All right, we always focus on the molar relationship first, and then if the molars are not both present, then we will use the canines instead. Okay, you do not have to do both. Okay, you only have to do one or the other, and so I want you to focus on the molar relationship first, and then migrate to the canines if needed. Okay, so but remember, you have to get it from both sides. You just can't say it's class 1 occlusion. I want to know, is it class 1 on one side, on both sides? So if it is on both sides, you say bilaterally. If it's not, then you give me the measurement. So we looked at her earlier for the previous group. Go and close down for me. On the right side, she is a class 1, okay, with an inclination to a 2. She's not a full 2 because it's not a full width of a premolar, okay? And so, but on the actual left side, go and bite down, she is a class 2, okay? So she actually has a class 2 on the left side and a class 1 on the right, okay? And so that's how you're going to document it. So class 1 on the right side, class 2 on the left, based off a molar relationship. Okay, that's what I'm going to ask you to do.
You
Yes,
would
ma'am.
want us to write class 1 tendency to 2?
You can say that. That's be more specific, but it's not the full. So you don't have to.
So
But
you don't have to.
You don't have to, but
But it's
if you,
not-
if you more specific you are, I'm happy with it. Okay.
And then
So-
also with the midline deviation, you want us to check that when we're doing overjet?
Yes,
Well,
absolutely. Okay, so as she closes down again, like I said, she has some attrition. Okay, the attrition we want to annotate because the reason we can identify the attrition is because she doesn't have the mamelons on her anterior teeth anymore, so you can see the actual grooves there. She says she doesn't know when she actually grinds, so normally that's the case if somebody does it at night. So our recommendation for those type of patients is that we're going to probably make a night guard for them. So yes, ma'am.
Whenever I got my braces off, the orthodontist, he actually like shaved down my teeth to come in while I was gone.
Okay.
Mine too.
So really,
How do they do that?
I don't
Well,
know why they did
I
that.
had an extra
So-
piece on number 7, so they probably shaved all of them.
Well,
have y'all ever noticed that though? For real? Whenever someone
No.
gets their orthodontic treatment done, their teeth don't look like normal anatomy. They all look like they've been shaved.
almost like cookie cutter?
I think
houses?
that what they're trying to do is they're trying to give the symmetry that people are seeking for aesthetics. But really what we're looking for is the normal tooth structure.
'Cause I remember that.
And so, but on her lower there, I can see that there's grooves actually on the incisal ledge there. That to me is a sign of attrition. Okay, and so you can actually see it if I actually can take my light and actually push it up towards my thumb, just so that it goes to my thumb.
To his
Go
thumb.
up,
Or like, yeah.
Turn
So
it
it
this way.
shines on his thumb.
Yes, perfect, excellent. So as I look there, you can actually see on the incisal edges there's a little groove there, okay? And that groove is a sign of attrition, okay? So, go and bite down again for me, all right? So we're going to take one last preliminary look to make sure everything looks okay. She does have some dicey granules that she pointed out to us, actually. And so inside of her lip here, you can actually see some little white sebaceous glands, okay, right up in this region. Okay, see those little white ones right there? All right, those are for dicey granules. Another thing we look at is for what we call petechiae. Yeah, petechiae are red.
I thought the granules were yellow.
They are whitish yellow. Okay.
Oh, okay. So they can be. Okay.
Yes. Okay. And so, but petechiae, and I discussed it with the previous group, is you have to be very cognizant of looking for those types, especially when you're grouping some of them, especially in the soft palate and beyond. Okay. Unfortunately, you actually see some patients that may have have been sexually abused, and that's a kind of telltale sign, and we need to identify those things. Okay. Especially for children, especially for women, even men. Okay. If you see bruising on the palate, grab the instructor, let us take a look at it, okay, because it's important that we identify those things at an early stage. I'd rather be wrong and report something than to be right and not report it and let that child or that person go beyond our walls. So
My 6-year-old Pete's on Tuesday has petechiae on her tongue, like in the back of her mouth, on her tongue, on her uvula, but I don't suspect it.
okay,
I'll let you look.
so we always want to take a look.
Yeah,
Okay.
I'll let you look.
And so-
Is that the only reason?
It's not the only reason.
Okay.
It's not the only reason for petechiae, but petechiae are just broken blood vessels that kind of come to the surface. Okay, but sometimes they're associated with trauma, especially when you see in the buccal mucosa, and also the soft palate. That could be a concern. Okay, and so unless you ask the patient, the patient has them on one side, and you say, okay, here, just bite your cheek. Okay, that's okay. Okay. But if you see groupings of them, especially large bruising, especially from the border of the hard palate to the soft palate, we want to identify that. Okay? Unfortunately, we have to be cognizant of that, and we have to be gatekeepers for that as well. All right? So, I learned the hard way in school, and I'm going to be honest with you, I didn't realize what it was myself, and I had an event that happened in school, and it was identified to me, and so I benefited from that, and I carry it forth with me, and I share with you.
Yeah.
All right?
That's
And
good
so,
to know.
Thank you for telling us about that.
and so just be cognizant of that, okay? Any questions, any concerns regarding anything that we just discussed?
Can we go over gender description?
Well, we're not going to go over digital description because that's not part of the EOI, okay? That's part of the periodontal assessment, okay? So that's why I'm not going to do that today, okay? The previous group asked the exact same thing. We're going to be revamping how with assessments are grouped together. Digital assessment is part of the actual periodontal assessment, so we're not going to do that for the intraoral, extraoral, okay? So you have questions?
Yeah, I had a patient who smoked, and on his hard palate, he had black dots.
Okay.
And my adjunct said that it was petechiae also.
I don't know if we call it petechiae, but what do we call that?
Smoking.
This is stomatitis.
Tobacco stomatitis, exactly. Or gingival stomatitis. So yes, all right. And so those things we're looking at. All right. Just know the proper terms to use. Okay. And I'm probably saying it wrong right now myself, but that's what it is. Okay. Those aren't really petechiae. Okay. Petechiae are usually reddish or purple, and they're usually broken blood vessels. Okay.
They were definitely black.
Yeah.
For sure.
So yes, ma'am.
I seen a girl, she had, I know when you have that crackhead in your lips, what is it, angular?
Chilitis.
Okay, but hers wasn't at the common hers was like down here, like looked like she's been licking, and it was like red and irritated.
My
And,
niece does that. Bites her
so
lip.
is that still considered,
think
word
that's
that you
chat.
said? Or is it just chaplain?
Usually when we focus on the commissions, we're going to call it chilitis. When it's beyond those regions, we'll call it, we'll just kind of give a generalization of what it is. But there's no specific term for that on the lower.
Okay.
Chat.
So, any other questions?
My niece does that.
All right.
She goes like, and then
So-
it's all.
My daughter does that. They just stay running.
Yeah.
So that is going to be the expectation from this point on. Okay? Yes, ma'am.
So you said the gingival description, you're going to be moving it to the periodontal.
The periodontal assessment.
So underneath the gingival description, it says it's the teeth area where you put malpositions and stuff. Are you going to move that up to the IOE?
The actual, the malposition case should be in the IOE as well.
So you just move
Yes,
that
yes.
up and then, okay.
Yes, okay.
Because it's underneath the general
Yes.
description.
Really, it should be in the EOIO, I call it EOIO, I apologize if you guys call it something different, but EOIO, or it could also be in the dental charting, okay? And when we have a tooth that is kind of twisted within its own position, we
Yeah.
call that what? Torso verted. If it's to the lingual aspect, lingual verted, and then
Or
buccal
labia verted.
labia verted, or if it's in the posterior section, posterior,
Buccal verted.
buccal verted.
Yeah.
All right. So, or if it's erupted beyond the plane,
If it's
super erupted. Okay. So, good. Use those terms. Let us know what they are. Okay. Let us know that you identified it. Especially because think about when you take radiographs. Okay, you're trying to get the contacts open, but you have a torso verted canine. And I think one of us had that the other day, and so it was you. And so they had a torso verted canine. There's no way you're going to really get that contact open, right? Well, you have to be able to identify that clinically so you can communicate that when you do your interpretation. You know, so we understand what you're looking at, so we don't mark you down on something you really can't physically achieve, right? And so let us know those things. But you have to identify them for us to know. Okay? Any other questions? Any concerns? All right. Thank you for sharing your time with me. I appreciate you guys staying today. And we're good to go, Katie. Thank you so much.